Hello.
Oh,
Good
hi.
morning.
Good to meet
Welcome.
you.
Welcome again. Your all preparations, all tests, medical history is looking good. I will ask you a couple of questions about your medical history
Okay.
for one last check, and then I will make your markings. Then you will be ready for the operation. Firstly, we will start with your mom
Okay.
because her operation is shorter than yours, so the waiting time will be shorter for you. Otherwise, you will wait too much. And then we will start with your operation immediately, and probably before midday we will be able to start with your operation. Your operation will take about 5, maybe 5.5 hours for me. For you it will take just one moment. You will be sleeping all the time. You will need to stay one night at the hospital, and tomorrow we will take you to the recovery hotel. So how old are you?
I'm 31.
Do you have any kind of disease? Any blood pressure,
Blood
diabetes?
pressure.
You have high blood or low blood?
High blood.
Okay. Do you use any kind of medications?
I
What?
take aspirin in the morning.
That's all? Okay. Any kind of blood thinner, hormones, contraceptives? Nothing? Do you have kids?
No.
No childbirths? No pregnancy? You are not pregnant now? Okay, that's fine. Did you have any problem with the anesthesia? Do you remember anything? Nothing. That's fine. And any kind of allergies?
No allergies.
Do you smoke?
I vape.
Yeah, please don't do it. It's not good for your recovery, for fat survival, for nothing. And do you have any problem with the boobs? Any tumor, leakage, anything else? No problem. That's good. So thanks for your answers. And could you please come close to me? You have, some fat under the skin. We will get rid of it mostly with liposuction. And actually, as I check your, skin, especially on your lower abdomen, you look like you have a sagging and skin excess also, and you look like you have a, tummy tuck indication. By the way, even you didn't have any kind of, childbirth or pregnancy history. But do you want a tummy tuck, or just?
I don't know what
You
you
don't.
recommend.
So it depends on your preference. So if you want to get rid of from all this sagging skin, the tummy tuck is the most guaranteed way. Okay, but it will give you a long scar on here. But in the patients who doesn't prefer to go with a tummy tuck surgery, the second best choice is the J-plasma skin tightening treatment, which is in your package also. But as a doctor, I need to explain, everything with the bad and the, good, and the advantages and disadvantages also. And as I check your body, you look like you have an indication for a tummy tuck surgery. But you are a young lady, you didn't have any kind of childbirth or pregnancy history, so you might not prefer to have it. If you don't prefer to have it, the second best choice is the J-plasma for you.
Yeah, I don't know. It's a tough decision because I don't know if I have children in the future. Maybe I'll have a child. Would it?
It will not make any difference, but so after the tummy tuck surgery, you can have kids also.
Okay.
It doesn't matter, but the pregnancy and childbirth, thing might make some more difference on your body. Some kind of, stretch marks and the sagging or some kind of skin excess again.
Yeah.
That's the reason. So it's not an obstacle to get pregnant. You can get pregnant, you can have child, but it's up to you, So let's make the, markings for a tummy tuck surgery also. You will have time to think about it, okay? Then after you make your decision, then we can go through on your decision, okay? So I will do a liposuction for upper, lower abdomen, for the side of your chest. I can do something for here also, and for your chin, you have some fat on here. I'm doing the lipo for the middle and side part of your chin to make the jawline sharper and the angle sharper than now. And on the arm region, the lower half is the target area, and I will do the J-plasma for here as well. And could you please turn around? And on your back, you will have the biggest difference on your low handles, but I will do the same lipo and J-plasma for the middle and upper part of your back, and for here also. And on the bum area, you look like you have some kind of depressions and flatness, especially on the side and on the top of the bum. After fat collection from here, I will try to fill it out And what is your expectation about the bump? Do you want a huge bump, big bump, or just natural, or anything else?
I don't want like a massive bump. I just want like a nice normal bump.
Okay.
Not like natural, but a little bigger, so it's still in proportion.
Okay, that will be logical. So the last part of the liposuction is the inner thigh and something for inner knees. I can do some lipo and J plasma to make the skin tightening more for these parts also. And the last part of the surgery is the boob job. Your boobs are looking like they're bigger than you need, and they are too much saggy, and the areolas are too wide. We need to reduce the areolas just a little bit and lift them up and remove the sagging tissues and make a lifting surgery. So you did mention for an implant also, but in your case implant is useless and you don't need it. You don't have any indication. The implant is just indicated with the patients who doesn't have enough tissue with small breasts. Your breasts are not small. An implant is not needed. In your case, I will reshape your own tissues and lift them up, and you will have much more better result than now.
But will it be the same size, or because I want to say like at a D?
For sure they will be just a little bit smaller than now, because I will need to remove the sagging tissues and sagging skin, and the rest of the tissues will be tightened up on the upper position, but they will still be in good size compared to your body. Another reason about the implant is that once we are making a lifting surgery, the nipples are, we are making a transposition to the nipples to the upright. So this transposition is making the blood circulation less on the nipples. So it's kind of something risky. If we put an implant on the base of the breast, the implant will make an additional pressure on the areola, and the blood circulation will be even worse. So it's quite risky also in the same session. Let's do the lifting surgery. Probably you will not have any problem and you will be happy with the size and with the shape. If not, after 6 months you can have the implant surgery in safer conditions. But right now it's risky, by the way. It's not only without indication, it's risky. Okay.
Yeah, makes sense.
So let's make some markings for you from back